This video provides instructions on surgical hand scrub procedures and their advantages. If this procedure is done correctly, this procedure should take 3 to 5 minutes.
Before beginning the surgical hand scrub procedure, you must remove all jewelry from both hands and arms. Inspect the surface of hands for breaks or cut in skin or cuticles. Cover lesions with dressing before providing care. Inspect the condition of nails. Ensure nails were smooth, short, and must not pass for fingertips. Remember, acrylics, artificial nails, and nails with foreign bodies are not allowed in the operating room. Put on your personal protection equipment. Make sure your hair and ears are tucked into your surgical head covering, and any neck jewelry is contained in your surgical attire scrubs. Use proper eye protection and a surgical mask covering your nose and mouth.
Start the primary scrub with the use of the disposable nail pick and clean under your fingernails under running water. Dispose of the nail pick in the trash can beside the sink and rinse hands and forearms. Once hands and arms have been washed, remove the sterile surgical sponge from its wrapper and moisten the sponge under running water by squeezing and releasing it. With fingertips together, stroke the nails in a back and forth motion with the abrasive side of a sponge. The abrasive side of the sponge should use in your fingertips, while the non-abrasive should be used for the remainder of the scrub. Scrubbing should start with your fingers, side by side including the thumb, and scrub at the surface of the palm 10 strokes. Continue with the dorsal surface of your hand. Remember, once you scrub an area, do not go back. Then scrub the outside surface of the thumb from the wrist to the tip of the thumb 10 strokes. Continue with the other side of the thumb and to each finger. After scrubbing your hand, proceed to your arm. Mentally divide the forearm into thirds from the wrist to the above of your elbow and scrub each part 10 times from top to bottom. Repeat the procedure to the other arm. And again, remember, once you scrub an area, do not go back. Begin rinsing at your fingertips and continue to the arm, forearm, and elbow, moving in one forward direction through the water. If you still need additional rinsing, completely remove the arm from the water stream and re-enter at the fingertips until you reach the elbow. Be sure to keep your arms away from your body and keep your hands above the elbow and let the water drip down the elbows. So, what are the advantages of surgical hand washing?
A small amount of microorganisms found on the hands can trigger the development of infection. It is an effective control measure as it prevents the spread of microorganisms and
to reduce the risk of transmission of infection organisms to oneself, to prevent cross-infection among clients.
The incidence of surgical site infections can markedly be reduced. To eliminate transient and reduce resident hand flora.
To reduce the risk of transmission of infection organism to oneself, to prevent cross-infection.
to clean up microorganisms and prevent their transfer, which would ultimately prevent surgical wound contamination from microorganisms found on the surgical team. Keep safe!